Baby Chakra. I am a physical therapist with master's degree in ortho and sports, having an experience of 7 years in this field, and I have come across many pregnant women, treated them, and provided them the exercises, guided them for healthy and happy pregnancy. So I am here on the stage to share the same with you guys, and I'm thankful to Baby Chakra for helping me out, for giving this platform to me to share this knowledge with you all. As I'm already late, I would start without taking much of your time. So yeah, we are going to talk on exercise and pregnancy. So let's get started. I always tell all of my patients, clients, that movement is medicine, and I firmly believe on it that as you keep moving, you will be staying away from the medicine, and this is applied to pregnancy also. Usually there is a wrong notion that you cannot exercise during pregnancy. We give less credit to our body than actually our body. So our body is strong, हम हमारी बॉडी है ना काफी स्ट्रांग है, बट हम लोग उसको इतना क्रेडिट नहीं देते हैं. And many of the patients that and the pregnant women I'm coming across, they are actually afraid of exercising. But I just want to say, if you exercise, then there are many of the complications that exercise प्रेगनेंसी ब्रिंग्स अलॉन्ग विथ, वो काफ़ी हद तक क्योर हो जाती है एंड काफ़ी हद तक बैलेंस आउट हो जाती है. So I would like to say this. One of the questions that everyone has in mind is, what exercises can I do during my third trimester to ease the delivery? So there are many exercises. If you haven't been exercising during the pregnancy times, then I would say just go for walk. Just go for walk, do stationary cycling, do swimming. This all things will, help you release your back pain, constipation, bloating. ये सब कम करेगा आपका. And also it will help you prepare for the labor also. Apart from this, there are many yogas that will help you out during this as you are preparing for the labor, and it includes deep squats, that is called malasan, child pose, also called as balasan. Then you can do uttanasana, Veerbhadrasana. Then you can go for breathing exercises that will help you for the labor. So some of the breathing exercises that can be helpful are deep breathing exercises. Inhale and exhale from the mouth. Inhale from the nose and exhale from the mouth. This is the exercise that will help you ease out the anxiety, that will help you perceive less pain. So अगर आपको pain perception ज़्यादा है, try doing breathing exercises. You can also do deep breathing exercises, in which one of those is diaphragmatic breathing. You have to keep one hand on the chest, other hand is on the stomach. As you inhale, blow your stomach out, and as you exhale, blow your stomach in. Keep your eyes closed while doing this breathing exercise, so that your entire body is completely relaxed, your stress is relieved, and there is much blood flow and oxygen to the uterus that will help you prepare for the labor. So this is the breathing exercise that you should do during your third trimester, along with walking for 30 minutes. Now, it is important to know the intensity of exercise, how much intensity of exercise you should be doing. So when you are doing the exercise, you should be able to talk normally. If you feel when you are exercising and you cannot talk, that means you are doing more than your body can actually do during the pregnancy, during the third trimester. So you need to reduce the intensity of exercise. So again, now when you're doing the exercises, you should make sure that overheating of the body should not be there, and well hydrated. You should be very hydrated during the exercises. So these are the things that you should keep in mind while doing exercise during third trimester. I would again like to repeat the exercises, that is walking, that you should be doing for 30 minutes. You should be going for stationary cycling. You should be doing swimming. You should make yoga part of your exercise. And in yogasanas, you can do child pose, that is balasana, malasana, that is deep squat pose. You can go for uttanasana. You can do Veerbhadrasana, that is warrior pose. You can do konasana 1 and 2, and Bandha Konasana, that is butterfly pose. These are the exercises that will help you in third trimester by lengthening your pelvic floor muscles, perineal muscles, and which is needed during the labor. When your muscles are relaxed, properly stretched, lengthened, then it will help you towards the normal delivery. So, yeah, you should be exercising during the third trimester, and yeah, do include breathing exercises. Okay, so the next question is, does breathing exercise help you during labor, and when should I start with them? Breathing exercise in your whole trimester is very helpful. It relaxes your brain, it boosts your mood, and it relieves your anxiety. Because what happens during entire phase of pregnancy is, as the baby starts growing, it along with your body, it also needs the good amount of blood, it also needs good amount of oxygen, right? So what happens, because of the pain, because of the anxiety, because of the stress level, if you are planning for pregnancy, or if you are first time going to be pregnant, you are time going to be delivered, then you are more stressed than the mothers who are going to deliver for the second time. So ये जब sorry, ये जब stress होता है, तो what we do is, we tense our shoulder muscles, we tense our neck muscles, we use more our neck muscles, we use more our shoulder muscles to do breathing, and we use less of our abdominal muscles, that is diaphragmatic muscles, to do the breathing. Diaphragm is the main muscle for breathing, and we usually skip that muscle. We start using more of these muscles, we start tightening these muscles, and we actually start feeling the tension over here. So in the whole course of pregnancy, breathing exercise is very important. But the question arises, is breathing exercises helpful during labor? Then yes, it's very helpful. The moment you start feeling the contraction, the moment you start feeling the first contraction, it's the time that you should start with breathing exercise. The name for the breathing exercise is Lemonade Breathe. What you have to do in this, before contraction and after the contraction that is coming, you have to inhale from nose and exhale from the mouth. Inhale nose and exhale from the mouth. Purse your lip and exhale. Again, inhale and exhale. You have to keep doing this before the contraction and after the contraction. Now, as the contraction increases, the intensity of the contraction increases, what is going to happen is, you have to increase the breathing exercises. So, labor is usually divided into two parts, part one and part two of labor. So, this is what you have to do in the part one of labor. And during the part two of labor, you have to inhale and exhale both from the mouth, but it has to be deep inhalation in and exhale out slowly. But keep in mind, before contraction, after contraction. The benefit is, you will perceive less pain during the labor. You will be more relaxed and focused while the baby is coming out. So make sure that when you are entering into the labor process, keep focus on the breathe, keep focusing on your breath, keep taking air in. You will be delivering more air, more oxygen to your baby. Fine. The next question that comes is, can yoga be practiced daily in the first trimester, and which poses I can do? Yoga in itself is very good. It will make you pro. It will prepare your body like a pro for the challenges that are going to come during the entire course of the breathing, entire course of the pregnancy. Now, if you don't have any complications, first do visit your gynecologist, your healthcare provider, and if you don't have any of the complications, then you can start with yoga in the first trimester. So before you start yoga or any of the any of the exercises, you go to your practitioner, you go to your healthcare provider and start talk to them that, is my body fit, is my body without any complications, can I start with the exercises, can I start with the yoga? And if they gave you the green signal that yes, you can start with yoga, then that's the time you can start yoga in the first trimester. The yoga that you can do safely in the first trimester is, you can go for lunges, you can go for Veerbhadrasana, you can go for Uttanasana, Konasana 1, Konasana 2, then Baddha Konasana. You can start doing all these yogas without any fear. You can do breathing exercises, that is pranayama, except the pranayama that you should be avoiding is Kapalbhati and Brastika. Apart from that, all the pranayamas you can practice. Make sure you are not holding your breath while you are doing yoga or any of the breath works or pranayama, because that loads your intracranial pressure gets increased when you are doing holding your breath. So never hold your breath while you are doing exercises, yoga or any of the pranayamas. Now, the next thing I have, the doubt that comes in mind is, I have preeclampsia and I am asked to have bed rest. Can I do some breathing exercises? Then, yes, the best exercise to go for in preeclampsia, if you have bed rest, then that is diaphragmatic breathing exercise, belly breathing. Diaphragmatic breathing exercise, which is also called as belly breathing. What you have to do is you have to keep one hand on the chest, other hand is on kept on the stomach, as discussed earlier. As you inhale from the nose, exhale from the mouth. Inhale nose, stomach should come out, and as you exhale, stomach should go in. This is the diaphragmatic breathing exercise that you should practice if you have preeclampsia. I would say if you are pregnant, then take it as a motivation to start exercising. Make this as a motive that okay, you haven't exercised earlier, that's fine. बिल्कुल ठीक है अगर पहले कभी exercise नहीं की है तो pregnancy should be a motivation to exercise. हमने हमारे ancestors को देखा हुआ है कि they used to do all household chores, and during that household chores सारी activities उनके सारे postures है ना achieve हो जाते थे. But because of the modernized lifestyle, westernization, we cannot do we cannot achieve certain postures which is actually needed during the entire course of the pregnancy, and to prepare the body for the labor also. So I would say that jitna body support karta hai, know your body, listen to your body, and according to the support that body is providing you, keep exercising. Exercise is going to help you out in maintaining the weight. It will help you reduce the risk of post gestational diabetes, again, blood pressure. Then it will help you prevent gaining overweight. It will help you reduce the back pain that is coming. So it will help you with good sleep. Mood swings को काफी कंट्रोल में रखता है. There are so many benefits that exercise provides you. So then why not to exercise? Yes. So baby chakra is providing great platform to everyone, so that all your anxieties, questions, doubt can be cleared, and you can have a safe and healthy pregnancy with baby chakra. By knowing your own body, you start exercising. If you have any doubts, come clear those doubts, but don't give up hope on exercising. Don't fear that exercise is not good for the body. Exercise is definitely going to help you out. Okay, so pregnancy is the first motivation to start exercising. Okay.